Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com, and today we're going to talk a little bit more about airway and mouth breathing, but specifically in the whole arena of orthodontic relapse. And I see this all the time, and it's really unfortunate when it happens. So let's talk about this a little bit. I have a ton of content already on what happens if you do not fix habits, be it mouth breathing or incorrect tongue positioning or even airway issues like tonsils and adenoids. That these aren't orthodontic things that we can necessarily fix. Some of these things are going to have to be fixed with ENT. Some of these things are going to be fixed with an OMT. If you don't know what these are, you should definitely look up those acronyms, OMT, ENT. And some of these things can be improved just with orthodontics alone. And a lot of times y'all are catching it and you're mentoring it to the patients and they're like, oh, I don't want to spend the money on OMT, or I don't, I tried to go to the ENT, but they wouldn't see me. Or sometimes they go to an ENT who's not that educated on orthodontics, which occasionally happens. And they don't feel it's urgent, or maybe they don't have great insurance, or maybe they really didn't even go, which is why I strongly recommend you always get a release on these patients in writing from the ENT saying, I don't think this patient needs surgery, because I can't tell you how many times it's BS. They just say they went, but they didn't really go. So get it in writing and actually saying that they do not need surgery and they can go ahead and proceed with orthodontic treatment. This is one of these documents that I have a template of if you want it. My documents are $20, but I give them away all the time in webinars. Matter of fact, I have a webinar going on in 2 days, if you listen to this, on Tuesday, November 28th, and I will be giving away documents. If you attend the webinar, you get a free document, and you can request the ENT document if you want. I have one on January 18th. So I'm always giving away freebies. But it's really sad when this happens, because maybe you finished the case, maybe you even did expansion and you're thinking, oh, I did palatal expansion, so it's all going to be good. Well, no, not always. And even if you're doing a sleep disordered breathing form and screening, a lot of times the parents really aren't putting the effort into screening these patients. And it's not like you can come to the patient's house at night and really see what's going on. Sometimes I'll have them record the patients. But that's only a snippet into their night. I mean, they may not be recording it at a time when these things are going on. So, unfortunately, what can happen if you don't fix the airway issue is that you might straighten the teeth, fix the bite. They may look fabulous, and 2 years later, this kind of stuff can happen where their jaw can grow down and back. They can start to get an anterior open bite. And these are the two most common things that happen. And sometimes when we get to that point, it's really hard to fix it, or sometimes impossible to fix it, without a jaw surgery, depending on their age and the severity of it. And then we're going to have to go back and have the OMT treatment and the ENT treatment and potentially retreatment with ortho and jaw surgery. Now, this is kind of covered in your informed consent, not in detail, not in enough detail, not necessarily enough to protect you. You would have to have a ridiculous amount of documentation to protect you from not only retreating for free, having insurance, having to give a complete refund, and even possibly more. So that's why I really hesitate for you guys to take these patients without and I don't even know if what I'm recommending in terms of, I have an additional lower jaw growth form. I don't necessarily have one just for this airway and mouth breathing. It's just so complicated and there's so many things that go into it. I mean, maybe an OMT might have one. I doubt an ENT would have one. I mean, I think it's definitely something we should definitely consider creating. There is a section about growth and unpredictable growth in most standard braces informed consents, and I believe also in the Invisalign informed consent. Hopefully you guys are having your patients sign an informed consent. But just some things to think about. You can catch, adenoids in a Ceph x-ray, and I do have a great, video on that. Your lingual tonsils, you can check just with it using the Ferris form if you're not already doing that. And, if you're catching one or the other, as well as seeing some red flags, you got to send your patient to OMT and ENT. It doesn't mean they have to do OMT treatment, but they need to do an OMT screening, which usually is $200 or $300-ish. But unfortunately, I would require that before I even consider. Now, you can bring an OMT into your office, and I have 2 OMTs I'm now working with that are virtual OMTs. I have one that I already made a bunch of contact with Tamara with Facial Physique, and I have another one who's based in Florida and New York, but she does virtual for you more East Coast people, and she's amazing as well. And she's gonna be making some content, and we'll get her information up as soon as she gets it to me. But I am super stoked to have you guys have more options for virtual OMTs, or even getting your team trained up on OMT and how to implement in your practice. Because if you're seeing a lot of ortho patients, you've got to probably be working closely with an OMT. Otherwise, there's a lot of patients you can't take. You're gonna relapse and have problems. So, all right, thanks so much. Bye.